So what is your risk of ovarian cancer? And can you reduce that risk by prophylactic surgery, removal of the ovaries and fallopian tubes? In some women, they have a very suspicious family history. Many women in either the father's side or the mother's side carry a mutation that confers a higher risk of both ovarian and fallopian tube cancer. Those known so-called germline mutations are known as BRCA1 and BRCA2. If those are identified in a family and in a particular individual, then it's usually recommended that those people undergo prophylactic removal of the ovaries and fallopian tubes by the age of 40. This virtually eliminates the risk of those cancers in those women. In women who don't have a suspicious family history, those women are considered at average risk for ovarian cancer, which is a relatively uncommon condition. If they undergo a hysterectomy for benign disease, such as a hysterectomy for fibroids and they're premenopausal, we often recommend preservation of the ovaries in order to preserve cardiovascular function, because the estrogen secreted by the ovaries during those later years, just around the time of menopause, probably protect the heart against cardiovascular disease. There's an intermediate risk group, slightly elevated risk. Women who have a very strong family history but test negative for germline mutations, BRCA1 and BRCA2. Those women may have yet undiscovered germline mutations and still are candidates for prophylactic removal of the ovaries and fallopian tubes.